What is actually radiation? We know it is in the waves and the particles also. Basically 350 rupees X-ray to the 25 lakhs of the proton therapy. Different modalities we are having in radiology is the basically conventional radiography, fluoroscopy, CT scan, mammography, bone mineral density, dental. So basically what are the units we'll use in radiology is the gray. This is the actually type of radiation deposited into the 1 kilogram of the body weight. And most of the factors what we'll see is the sieverts. It is radiation dose multiplied by the radiation factor, that is the X-ray, which is the 1. So radiation weighing factor is the 1. And we'll see what is the maximum dose can be given to the patients for the treatment. This is the different body parts, and this is the different amount of radiation we can give per kg body weight. And what will happen? We know now the radiation. What happens if we will not take the precautions? What are the disadvantages or what are the hazards of the radiation? For example, if you are met with the accident, nothing can happen. Just will get up and will be normal. Second, we'll get the injury, lacerations or the fracture. It will be treated and will be normal. Second will be the will survive, but severe several damages, like one leg or the hand can be removed completely, brain damage, in permanent coma, and totally damaged. So after the accident maybe die. Similarly in the radiation, no damage to the cells after X-ray or the CT scan or the radiation therapy. Cells may be damaged but repaired. Cells survive with the mutation which leads to the ultimately cancer. And the fourth one is the how will die if we met with the accident, same that cells will die. So biological effect of the radiation are the deterministic effect and the stochastic. Deterministic effects are those, if you have some threshold, definitely you are getting to get this one. So the most common is the cataracts and the damage to the reproductive system, blood circulatory system, digestive system. And the stochastic hereditary effects are the genetic, which can mute the DNAs and it will comes into the next offsprings. So this is having the threshold. We had seen in the CT also, threshold means if you are giving so much Hansel units, then it will be triggered. Same, like if you give the more radiation, you have the skin burns, and like the DNA cells will be, one cell will be damaged, and after growth it can turn into a cancerous tissue. Stochastic, these are likelihood of getting the leukemia, that is the one type of blood cancer. Deterministic of the severity will increases if the dose is increases. So we are having we categorize the radiation exposed to the public into the 3-4 types. One is the occupational workers, those who are working in the radiation area. Medical exposure, those it will giving in the form of radiation therapy to the patients. And the public exposure, the attendants who comes to along with the patient. And the natural exposure with all the human individuals living in the environment. So whole body is the 20 millisieverts maximum permissible dose to a occupational worker, and the 150 millisieverts for the lens, and the 50 millisieverts for the total body. Then how we protect? By using these things. ALARA, just this presentation should be completed as fast as possible. The AFAP, same thing, ALARA. ALARA is as low as reasonably achievable. Like for me, for chest X-ray, you are giving the 70 kV and the 12 ms. So for a small child also, you should not give the same thing. You have to give as low as possible, like the 50 kV with the 6 ms according to the patient. And second is the TDS, time distance shielding. So spend as much low time as possible in the radiation area and keep the distance and have the shielding. The shielding is, so this type of RSO awareness question also you will get. Because this investigator, definitely it's a long question, right? It may carry the 10 or the 20 marks, and you have to have the shielding in the form of lead glass, lead barriers, and the aprons. And the wall of this primary beam, the beam, it should be at least 9-inch brick wall, red brick wall, or the 23 centimeters. And the operational the safety must wear the TLE badge under the lead apron, not above the lead apron. TLE badge you must wear inside the lead apron, not on the lead apron. So as a students, when you progress into the technologist and the radiology chief technologists or the radiation safety officers, the managers, these are things you are going to do by yourself. Like you are seeing the TLD badges. If you are starting your own department or own diagnosis center or own hospital, you are leading the department, then you have to register your hospital at the center with the laboratories which is providing the TLD badges, and you have to register each and every individual who are working in the radiation area. So for example, which I did for the active workers as 45, and you will get the dose reports. And these are the ARB sites. Anyone can go and lead how to use the radiation safety measures. And all the radiology equipments in the department must have the licenses, which is having the expiry date also. For that one, you must have the quality, because radiation give the hazard, so it should be, quality should be checked. For example, if the machine have to give the 70 kV and the 10 ms, it must give 70 kV and ms. For that, quality is required, and there should be no leakage radiation either from the tubes or from the lead barriers or the lead aprons or from the lead doors. So what is the QA as per the AARB? QA is the, means I told you already, as what is the specific kV and MAS the equipment should give, that much only it should give. It should not give less or more than that one. So how frequently it should be carried out? It should be carried out at least this compulsory in 2 years. Every 2 years you have to do the QA of the radiology equipments. So these are the diagnostic radiology equipments. These are the quality QA equipments for see the radiation safety. And there are 959 agencies in India which are recognized and registered by the AERB, from which your radiology equipments, X-ray, mammography, CT scan, fluoroscopy, CM should be. Quality assurance must be done every 2 years. So, and lead apron salt, thyroid shield also must be carried out at least once in 2 years by the AERB. Once quality check can be done by taking the radiograph of the lead aprons at least once in 2 years. So NABH, because most of the private hospitals and the most of the government hospital going the NABH, which is mandatory. For that one, radiation safety is high compliance with radiation practices, and must be radiation, each modality must be displayed with this one, your equipment name, model, license number, and this is the caution X-ray symbol, which is having the triangle with the X-ray tube emitting the X-rays, and the pregnancy caution, and the license which is given to the center. If you are not having, if any center which is going for the NABH or JCI accreditation, if they don't display this type of license just outside the door, they will get the non-compliance, 1 NC for that one. And if you are not carrying out QA of the lead aprons, another NC. If you are not carrying out the QA in 2 years, then you will get another NC. And even on the mobile X-ray also, you have to display this radiation license and the safety symbols. On the operation theater, if you are using a CM, must be displayed this one. And the lead apron should be handled like this, and this is the QA test must be done every 2 years for the equipment, even CM also, if it is operating in the, even it is operating in the ERCP or the operation theater. If you are doing everything, then confidently you can face the NABH team if you are following the radiation safety practices. And this is at the ARB along with the Srinivas sir, almost 3, 4, 5 years back. And I am thankful to my teacher and the mentor, Dr. L.T. Kishore sir, because of whom I am into this radiology field and practicing still as a radiation safety officer.